Apologies, everyone, once again. So we're just waiting for the department to join us. It's just a little bit of a technical issue that we are having on that side. So apologies once again from my side. Yeah, but while we are waiting, please let us know where you are trickling in from, and we can give a shout out to you. So as I've mentioned, September is Rabies Awareness Month, and we are having some very interesting conversations around rabies, specifically in livestock. So Dr. Alicia Cloete, state vet from the National Department of Agriculture, will be joining us to talk a little bit around the topic, and we are quite excited about that. Let's just see. So thank you so much for your patience, everyone. And we are back. Okay, yeah, the department is... So just gonna grab my laptop for a second. Hi, Doc. Here we go. You have requested to... Let's take it from there. Okay.
Yeah. Yeah, can you see me?
I can see you. Good afternoon.
So thank you so much, and sorry for the technical difficulties. We're joining via cell phone now, so hope that this will work.
No, it's perfect. Well, thank you so much for joining us, Dr. Alicia Cloete. You are a state veterinarian at the National Department of Agriculture. And while we were waiting for you to join, I was just asking everybody where they are from and telling them this is an interactive conversation. So if they do have questions, you are with us today, so they are more than welcome to ask them. But firstly, how are you doing today?
Doing very good, thank you. Just cold. Didn't think I would be wearing this in the middle of September. How are you doing, Octavia?
I actually mentioned to everybody that I'm joining from the Eastern Cape. It's quite chilly on our side as well. But it's surprising that the weather is the way it is, but also the reality of climate change during this time and seeing it in front of our eyes.
Yes, I think it shows us that there are weird things to come that we need to prepare for and try to prevent us spilling over the edge where we can't get back from climate change.
No, that's true. Doc, once again, thank you so much. So September is Rabies Awareness Month. We actually had a conversation yesterday. So for those who don't know, that we have a podcast called Farmers Inside Track, and Dr. Alicia Cloete was having a conversation with me yesterday on a specific topic. So please join, listen to that conversation over there as well, and follow us on Farmers Inside Track. So before we kick it off, I'd like to maybe just say that it's such a privilege to speak to you. Some of the farmers that are joining us are quite excited to have you here as well. So I'm quite excited to hear if they have any questions for you. But as we are kicking it, maybe Doc, if you could just explain to us what exactly is rabies, how is it transmitted, and what are some of the common symptoms?
Okay, so rabies is caused by a virus, Alicia virus, and it's able to infect basically any mammal species, and this includes humans as well. So what this virus does is it infects the brain of its hosts, and this leads to behavioral abnormalities, disturbing neurological signs, and eventually leads to death as well. This is one of the most deadly diseases known to man, because once you start showing clinical symptoms, there's no cure available, and unfortunately an animal or human with rabies will die. But the good news about this disease is that we are fully able to prevent it. And we mainly do this through the vaccination of dogs and cats and other animals, and also through providing post-exposure prophylaxis to humans that have been exposed to rabid animals. So how this disease is transmitted, the virus is shed in the saliva. So if an infected animal like a dog or a jackal or mongoose attacks and, let's say, bites, scratches or licks another animal or human being, and that saliva either enters a wound or through your mucous membranes, the virus enters your body, it travels through the neurons to the brain, and your brain gets infected. This can take several days, several weeks to several months to happen. So there's often quite a long incubation period between contact and getting infected and before you start showing clinical signs. So basically, if I just summarize the typical signs that you'll see regarding rabies in animals, because it infects the brain, you'll see a change in behavior. You'll see animals that are usually tame, like your pets, become aggressive, and your wild animals can also become overly aggressive, or they can become tame and start approaching humans. And that's usually the danger zone when humans approach this animal that has become tame, and then they get attacked. You'll also see excess saliva that's dripping or foaming from an animal's mouth, and sometimes it looks like they can't swallow properly or like they've got something stuck in their throat. They may also vocalize continuously and make strange noises, and as the disease progresses, they may become wobbly, and eventually they become paralyzed and die.
Thank you so much for that introduction, Doc. As a pet lover myself, I have 3 cats, and we were briefly speaking about it yesterday as well. To me, what as a pet lover, what are some of those preventative measures that we should take in order to prevent rabies?
I'm very glad to hear that you're a cat person as well. I also have 3 cats, and all of them are vaccinated against rabies. So the thing is, prevention is so simple, and that's why we focus on vaccination so much. According to law in South Africa, if you own a dog or a cat, you have to have them vaccinated against rabies. This vaccine is extremely effective, and if your animals are adequately vaccinated, they cannot get rabies. And this protects them, and in turn, it protects you that's in contact with your pets. So usually once an animal, a dog or cat, is about 3 months old, it's time to give the first rabies vaccination, and then we boost them again 1 to 12 months later. After you've given them these 2 initial boosters, according to law, you have to revaccinate them every 3 years, but we usually advocate if you're in a high-risk area or if you're staying on a farm and your pets are potentially exposed to wildlife and other free-ranging animals, it's better and safer to have them vaccinated every year. And also remember, if you missed a vaccination at 3 months of age, you can start the first vaccination at any age older than that. So it's never too late to start vaccinating your animals.
So it's always just important to do it, whether if it is at a later stage and what you are even learning today, specifically Dr. Alicia Cloete's words. So Doc, let's just get into rabies specifically in livestock. What is rabies in livestock and how is it transmitted?
Okay, so basically, unfortunately, because livestock are mammals as well, they're equally susceptible to rabies, and usually it's transmitted to them through other animals that they're in contact with. For example, infected black-backed jackals, bat-eared foxes or mongooses, or even stray roaming dogs that have got rabies. So if your livestock, whether it's sheep, pigs, goats or cattle, come in contact with these infected animals, those animals are often aggressive and start attacking your livestock. So if they're bitten or scratched by these infected animals, they get infected, and then after a period of days, weeks to months, they can start showing clinical signs. So as a rule, we don't really vaccinate livestock to prevent rabies in South Africa. Our main focus is on dogs and cats because we're in such close contact with them, but it is possible to have your livestock vaccinated as well. If they're vaccinated, they would be protected. If they're not vaccinated, they would be at risk of developing rabies if they're exposed. So if you do suspect that any animal on your farm, whether it's a dog, whether it's livestock or a wild animal behaving strangely, this is the perfect time to contact your state veterinarian, technician or private veterinarian to ask for more advice regarding rabies.
And some of those common symptoms within livestock, as you mentioned, Doc, let's just trickle into, we've spoken about pets in general. but specifically within the livestock itself, what are some of the symptoms that farmers can identify to say that, yo, I really need to check this out. The vet needs, my livestock needs vet attention.
Okay, so let's firstly look at cattle. So obviously you'll see behavioral abnormalities once again, and you'll see neurological signs. So we typically see that they develop this hoarse type of bellow, they vocalize often, they become very aggressive, they might attack other farm animals, humans, and even inanimate objects. It might also look as though there's something stuck in their throat and they're salivating as well. They can separate themselves from the rest of the herd, stop eating, and then eventually they become uncoordinated, they fall around and eventually become paralyzed as well. So it's not always this whole combination of symptoms, but sort of what you need to look out for is strange behavior that's abnormal. And like I said, any neurological signs like an animal falling around or being unable to swallow, that's usually typically what should alert you to rabies, especially if you know your livestock can be in contact with wild animals. If we then move on to sheep and goats, very similar signs to cattle, but they can also start exhibiting hypersexual behavior, incessant bleating, so they just continuously vocalize. They also become aggressive. They may aimlessly wander around. They may paw and paddle at the ground as well. But what can be very prominent as well is grinding of the teeth and the excess salivation. If we look at horses, they can also show altered behavior, also become aggressive. They might start biting at the original site where they were injured by a rabid animal, and they also become paralyzed eventually. Pigs also typically exhibit hypersexual behavior, aggression, they start biting, and they even may kill their offspring if a sow has farrowed recently. So overall, you're looking out for abnormal behavior, an animal becoming aggressive or becoming sort of dumb and very, very tame, and then also the neurological signs and excess salivation that you're looking out for.
Thank you so much. For anyone who has any question before we continue, if there are any questions that you have for Dr. Cloete, you are more than welcome to add a comment and we will be able to read them out. So once again, this is an interactive platform. Please do join us with this conversation. If you have any question, by all means, Dr. Alicia Cloete is right here live with us. So Doc, before I continue, I just want to say that once again, it's such an amazing privilege to have someone that has so much expertise on this topic and to be able to talk to us about it. But before we get into how, I actually want to ask the topic around the susceptibility of livestock and which ones are the most vulnerable to them. You know, why is it so important to raise awareness when it comes to rabies?
I think when it comes to rabies, because this is such a deadly disease, we really do need to pay attention to it. I think it's a matter of everyone always thinks it can't happen to me, it can't happen to my animals until it hits you. And unfortunately, like I said, once an animal or human starts showing clinical signs, then it's over. There's no treatment available. So that's why it's really important for us to keep the discussion going and to remind ourselves that rabies occurs in all 9 provinces in South Africa. So you can't say, oh, I stay in Gauteng or the Western Cape or the Northern Cape, I'm safe. Remember that it stays endemic in our wildlife species and then it spills over to other animals like livestock and typically dogs as well. We've also got continuous dog rabies cycles more in the eastern parts of our country. So it's your northeastern Limpopo, Mpumalanga, KwaZulu-Natal, and the Eastern Cape, and also then along the border of Free State and Lesotho. That's where we typically find dog rabies. But just because the rabies isn't in the dogs doesn't mean it can't affect humans and livestock. Obviously, these dogs can then transmit it to livestock as well. So again, thanks a lot, Octavia and Food For Mzansi, for this platform. It's very important to keep this discussion going.
Thank you so much for that. So just to trickle back to the question that I just asked, the vulnerability, which livestock are most vulnerable to rabies? You've mentioned we've spoken about what it is, how it's transmitted, some of those common signs, but which one of those livestock is quite, and for farmers to be aware or wary of, that my livestock could potentially be vulnerable to rabies?
Okay. In this case, all livestock are equally susceptible. It just depends on if they are exposed to an animal that has got rabies. So like I said, it's typically your black-backed jackal, your bat-eared foxes and mongooses, and then free-ranging dogs that are infected with rabies that can infect your livestock. So it's very important here to, if possible, kraal your animals at night to keep them safe from wildlife and other dogs, and ideally to have a sheepdog or ostrich or donkey that serves to protect your herd or flock and will alert you if anything is wrong. And if you're using a sheepdog, ensure that they're vaccinated. So the big thing here is preventing exposure to wildlife that could potentially have rabies. Then it's also really important to stay in contact with your local state veterinary office to find out if there's been any recent rabies outbreaks in your area. And if you know that there are active outbreaks in rabies or in dogs or in other livestock, you can then vaccinate your livestock against rabies to protect them. In this case, please contact your local state vet or private vet so that they can assist you with the correct vaccine and vaccination schedule for the specific livestock species that you're farming with. And then if you encounter wildlife that behave odd on your farm, for example, a mongoose or a jackal that seems very tame, that's approaching you or the household, or that's acting aggressively and that wants to attack your animals, you need to report this to your local state vet office immediately. Also, if possible, if you are quite sure that this is in fact a rabid wild animal, it is best to rather shoot the suspect rabid animal so that it can be tested by the state veterinarian for rabies, and also obviously to prevent them from coming in contact with humans or other animals to transmit the disease.
Thank you so much, Doc. You actually answered my final question to an extent, where there's certain steps that you need to take in order to know and to prevent as well. But just before we end off, and we actually have a question. It's, hi, when to start vaccination in dogs? When is the best time to start vaccinations in dogs?
Okay, so as we discussed a bit earlier, it's never too late to start vaccinating. So cats and dogs, any age, you can start vaccinating them. Usually animals that are younger than 3 months of age, if you want to vaccinate them, it's fine, but then you need to revaccinate them again at 3 months of age and then give that booster vaccine 1 to 12 months later. So if you have a dog or cat and they're 3 months or older, it's time to get them vaccinated.
Thanks so much. Is there anyone else who has another question before we end off the live? But before we do that, I just want to ask Doc, what are those, briefly, some of those practical steps that someone needs to take or a farmer needs to take? Top 5 tips that they can take with them to remember. What are those practical steps that you need to take in order to prevent rabies on your farm or within your pet, within your place?
Okay, so definitely most important is if you've got cats and dogs on the farm, please have them vaccinated. They're the most important animals to keep vaccinated on your premises. And then if you do suspect that your livestock has been infected by rabies, it's very important to immediately isolate those animals so that they cannot escape and run away or attack other animals or people, and so doing spread rabies. So also try not to handle these animals directly, rather just close them off. And then call state veterinarian, private veterinarian, animal health technician, or welfare organization immediately to come and assist. You can even contact the police. Just a note on that as well. Like I said, one of the symptoms in livestock, especially cattle, is it looks like they can't swallow and there's something stuck in the throat and there's excess salivation. If you see this and you're actually suspecting rabies, please do not put your hand down that animal's throat. Like we said, the virus is shed in saliva, and you definitely do not want to come into contact with that. Then that just said, just the last word, especially if you as a human think that you were perhaps exposed to rabies either through infected wildlife, livestock, or cat or dog that you think might have rabies, it's very, very important that if you were licked or bitten or scratched, to wash that area very, very well with soap and running water for 10 to 15 minutes. So you're really washing that wound well. Thereafter, it's basically an emergency situation. Even if it's just a small scratch or small bite with little blood, you have to go to your nearest medical facility in order to receive rabies post-exposure prophylaxis treatment. So that consists of a series series of vaccines that you need to complete. And if there's an open wound, they'll also inject rabies immunoglobulin directly into the wound so that it can bind that rabies virus. Really, really important. This is the only point at which you can stop the transmission of rabies to a human being. If you leave it and you decide, it's not a big wound, and then you start developing symptoms of rabies a few weeks later, then it's too late to institute treatment. So remember, if you think you've been exposed to a rabid animal, immediately seek medical treatment.
Thank you so much, Dr. Alicia Cloete, State from the National Department of Agriculture. It was an absolute pleasure to talk to you and learn from you. So we do have another question. Is there a cure for infected animals?
Okay, unfortunately not. Like I said, once an animal or a human starts showing clinical signs of rabies, it means that the brain is already infected by the virus and there's no cure available. And whether it's a human or an animal, unfortunately, the patient will die because of this disease. So that's why it's so important to make sure that your pets are vaccinated against rabies. That is how you prevent them from getting the disease and from dying from the disease. Remember to vaccinate.
Thank you so much, Dr. Alicia Cloete. Just emphasizing on that once again made me realize the seriousness on this topic and just rabies itself. It's so important that we learn from this conversation. And for everyone who has obviously joined us, thank you so much as well. And for the questions that came in, we absolutely appreciate it. As we mentioned, it was an interactive platform. And if there's any last questions before we tickle off, if there's anything else that you'd like to ask Dr. Alicia Cloete, I am willing to just relay the message. But once again, Doc, thank you so much. It was an absolute pleasure. There's another conversation that we had on health risks for pets that's on our Farmers Inside Track. Make sure to follow us there, and Dr. Alicia Cloete expands a little bit more on that specific topic as well. So once again, thank you everybody. Thank you for joining us. Thank you, Dr. Alicia Cloete.
Thank you, Octavia, and thank you for everyone that joined in. Really appreciate your time. Thank you.
Bye, everyone.